Hello, my name is Morgan Fiedler, and for today's poster, we're going to be discussing Chapter 14 with psychological disorders. The disorder that I chose is a newly classified eating disorder, the binge eating disorder. Binge eating is classified if you're eating much faster than normal, eating until you feel uncomfortably full, still eating lots of food without being hungry, eating in secret because you're ashamed or embarrassed, or feeling negative emotions like guilt, shame, or depression after a binging episode. I would like to note that binge eating disorder is different than bulimia because there's no purging stage during the cycle. So, like during that cycle, you'd go through, you would eat and feel the guilt, but then you would want to cleanse, and so they would purge. But when you're in the binge eating, there's no purge. This disorder is estimated to have impacted nearly 4% of all women and 2% of all men throughout their lifetime. And then the populations that are most at risk are athletes, teens, college age students, and people of color, adults over the age of 50 years old, and the LGBTQ plus community. Some emotional behaviors and cues include hoarding food in unusual places, cutting out entire food groups, randomly skipping meals, developing food rituals which occur like while they're eating meals, and like having their food not being able to touch or only eating certain types of food, and then feeling disgusted or ashamed after eating. Physical cues include stomach cramps, lots of fluctuations in weight that can be like either up or down, low self-esteem, constantly looking at their imperfections like in the mirror or like on their camera, and then having trouble concentrating. So now let's talk about treatments. There's psychotherapy, where you can get like cognitive or behavioral therapy that work together, and they help learn with like the behaviors that you're actually having or like the mindset behind everything that's going on. There's also weight loss therapy if that's something that like is leading you to the disorder, if that's what you need to focus on. And then there's also, you can get like medication prescriptions. Treatment is based on severity of the eating disorder and then like the reasons behind why you developed it in the first place. Recovery through treatment and even after can be kind of difficult. It can be a super long journey, so you have to be patient. Recovery is something an individual is like constantly working towards and trying to become healthier and overcome this. But then there's relapse. Not always, but there can be relapse. This is where someone can encounter like a trigger, they have a setback with their eating disorder, and then they fall back into their old habits, or they have like a relapse. They can be common with any type of disorder, not just eating disorders. And then another thing to note is that many people think like yo-yo dieting is one of the reasons behind this. So that's where you like switch from diet to diet, and in doing so you're cutting out certain food groups, so you're restricting how much you can eat of certain things, and since your body's lacking it so much, and then going back and forth between lacking so many different things, once you like give into those cravings, you just keep going and you can't stop. So yo-yo dieting is one of the things that are seen to like make it worse. Okay, thank you.